Yes.
Okay, do we have everyone in the room now? All right, good morning, everyone. We are just waiting for a few more minutes to allow participants to join. This event is being recorded, and the link to the captions are going to be in the chat box. Please email Erin Harden, whose email is in the chat box, if you have any questions along the way. We'll wait for one more minute, and then we'll be able to get started. Thank you all for being here. Okay, and we have our esteemed moderator with us this morning, Mr. Mohammed Ali Hlpf.
Hello.
If he might be able to turn on his microphone to join.
Hello.
Good morning, Mohammed.
Well,
Welcome.
I don't know. I was not included as a panelist. Anyway.
We are glad you're here. You are a panelist now. And we are pleased to get started.
All right.
With your leadership.
Sure. Thank you, Bethany. Good morning, everyone. Very sorry for this technical interruption. It's a great pleasure to have you all here attending with us this webinar. We have distinguished panelists who are going to speak about their submission to the high-level political forum. Before I give the floor to our panelists, I would like to start with giving you a brief background about the HLPF. The High-Level Political Forum was adopted in the year 2012 during the Rio +20 UN Conference on Sustainable Development. And since the adoption of the Sustainable Development Goals, the stakeholder group of persons with disabilities has been involved in the discussions and in the events that take place during the High-Level Political Forum in July, and also supporting the groups of persons with disabilities around the world to participate in the drafting of the National Voluntary Review reports. We see this conference or this event as an important activity for us as a stakeholder group of persons with disabilities, because we want to make sure that governments are showing extreme compliance to the rights of persons with disabilities according to the disposition of the CRPD. And we want to make sure that the delivery of the Sustainable Development Goals is really based on the principles of inclusion and accessibility for persons with disabilities. Every year, the HLPF focuses on a number of goals. This year, we are definitely focusing on no poverty, goal 1, zero hunger, goal 2, goal 3, health and well-being, number 8 on decent work and economic growth, number 10 on reducing inequalities, number 12 on responsible production and consumption, number 13 on climate change, number 16 on justice, partnership on justice and institutionalization, and also on number 17 on partnership. We have today 3 panelists. Dario Aryani from Indonesia. She is the program officer of Disability Rights Fund and Disability Rights Advocacy Fund. We have Manal Mar'i from Inclusion International. Manal is from Tunisia, and she is the human rights officer at Inclusion International. We have Muhammad Rahul Karim Sadiqi from Bangladesh. He is a DPO engagement officer at the International Disability Alliance. Each one of them is going to speak about a submission paper that they put together addressing the issue of the disability inclusion of the Sustainable Development Goals. Especially this year, it's very important given the context of the ongoing COVID-19 pandemic. We have noticed a major interruption in the process of the implementation of the Sustainable Development Goals. And everyone nowadays is talking about how we want to continue the implementation of the Sustainable Development Goals in the next 10 years, reaching the year 2030. So we want to make sure that this process is also inclusive and accessible for persons with disabilities. We are talking about employment. We have experienced or seen major challenges for persons with disabilities who were already excluded from the labor market before the pandemic, especially in the formal sector. So we want to discuss with our panelists, starting with, I think Dayo is going to speak about that, or Rahul. And we're going to talk about how we want to address this issue, the issue of reducing inequalities by Ms. Manal Mar'i, who is going to talk about how persons with disabilities have been excluded in the social protection programs during the pandemic, especially with regard to the distribution of food and medicine. And also we would talk about about access to justice, especially that persons with disabilities are not treated equally. There are no measures of accessibility and inclusion, which causes persons with disabilities to be overrepresented in prisons, and also because of the distancing issue and the lack of persons with disabilities are more subject to contracting COVID-19. So let's start with the first panelist, who's going to talk about Goal 8. I think that's Daru or Muhammad Rahul. Please go ahead. You have 7 minutes, and I will give you a warning 1 minute or 2 minutes before your time is up. Please go ahead. Thank you.
Thank you very much, Mohammed. Hello, everyone. This is Rejaul Karim Siddiqui. I work with a program called Inclusion Works, which focuses on how labor market systems can be more inclusive of persons with disabilities in formal employment. I'm based in Bangladesh and working as OPD engagement officer under International Disability Alliance. My heartiest thanks. I noted 9:44 hello, can you hear me?
Yes.
Okay, thank you. My heartiest thanks to the organizers for giving me the opportunity to speak here. Today, I will speak on Sustainable Development Goal, as Mohammed said. I know that it's Sustainable Development Goal 8, which deals with decent work and economic growth. I, along with my colleagues, worked on the submission of IDA inclusive livelihoods task team's submission on SDC 8 for the stakeholders. Today, I will share overview of the SDC 8 based on my submission we worked on few months back. You know, persons with disabilities have very limited access to labor market. Oftentimes, employers struggle with not having enough knowledge to absorb people with disabilities in the workplace, or they feel that it is more expensive to hire people with disabilities. Employers have another misperception that people with disabilities lacks ability to work. All these myths and misperceptions have narrowed down our access to employment. Right to employment is influenced by some other factors, and these factors include access to education, access to social protection systems, and the degree to which communities and workplaces are accessible. The employers sometimes impose criteria such as age limits, or they set educational requirements, which causes de facto exclusion of persons with disabilities. A 2016 study shows that in Kenya, people with disabilities felt that ineffective laws, policies, including the 5% quota provision, greatly contributed to unemployment among persons with disabilities. The people with disabilities living in other countries, including Bangladesh, are experiencing the same as Kenyan people with disabilities do. The Convention on the Rights of Persons with Disabilities, which is popularly known as CRPD, is a great charter for people with disabilities. Therefore, we the people with disabilities expect that the CRPD must be at the core of creating inclusive and equitable labor markets in actually to labor markets to achieve the SDG 8. The Article 27 of the CRPD defines the right to work. Employment programming that aims to fulfill Article 27 must approach access to employment holistically, keeping in mind efforts at influencing factors, barriers around education, transportation, accessibility must be removed in order to make labor market systems more inclusive. We are in unprecedented times of new normal. The rights of persons with disabilities must be considered in the overwhelming changes brought about by the COVID-19 pandemic. Working from home and working remotely for persons with disabilities mean that they need to be provided with the required support and accessible and inclusive technology. To be noted, any transformation to labor markets must be rooted in human rights and must not discriminate against persons with disabilities. You know, diverse initiatives are being taken to support the inclusion of persons with disabilities in the labor market. These include capacity building initiatives concentrated on digital skills as well as soft skills and hard skills development. There is need to ensure that people with disabilities are in the design stages of these initiatives. Such initiatives should not pose additional barriers to the participation of people with disabilities. Information should be spread in all accessible formats, including Braille, sign language, easy to read versions, large prints, audios, among others, as a move to operationalizing reasonable accommodation. Specific measures and affirmative actions must be taken for inclusion of most marginalized, those with intellectual disabilities, psychosocial disabilities, deaf blindness, for their inclusion in the labor market equally with others. Finally, I would like to reiterate putting the CRPD at the core of inclusive employment for persons with disabilities must be emphasized as an urgent action to redress the injustices that people with disabilities continue to face in labor market. Many thanks for your patience. Mohammed, over to you.
Currently unmuted.
Hello? Hello?
Hello, hello.
Yes. Mohammed?
Yes,
Uh,
yes,
all
I
right.
have done.
Thank you very much. I really appreciate it. That was wonderful. And we look forward to our discussion about this topic later on during this webinar. Please allow me to now to turn to Ms. Manal Marai from Tunisia. And again, Ms. Manal is the Human Rights Officer at Inclusion International, and she's going to talk to us about the about goal 10 on reducing inequalities. Ms. Manal, the floor is yours.
Thank you, Mohammed. Good morning or good afternoon, everyone, wherever you are. So I will present today Inclusion International's contribution to the stakeholder group on persons with disabilities on the goal 10 on reducing inequalities. So we know that people with disabilities are among the poorest groups of people around the world. This is due to many factors, such as the disability-related costs, the difficulties in accessing and maintaining employment, the barriers to access school, or the inadequate social protection programs. This is a reality in many countries, but this has been amplified because of the pandemic. People with intellectual disabilities were less likely to be in paid work prior to the pandemic. And the ones who were employed were mostly employed in sectors that were hardest hit by the COVID-19. These include, for example, the retail and hospitality sectors. The crisis has caused a lot of job losses and business closures. Many people with intellectual disabilities who were employed have lost their jobs. The ones who retained their jobs had to work remotely, but they lost their support, which strongly impacted their work. Another issue is with regards to families. Families became the main and only support of their relative with intellectual disabilities because of confinement and other restrictive measures, which impacted the provision of support services in many countries. This has impacted families in their jobs as well. Such situations amplify the gaps between families who have a member with a disability and those who don't. In addition, through some surveys and the webinar that Inclusion International held last year, we heard from our members in many countries that programs put in place by the governments in response to the pandemic were not inclusive, and some were even more discriminatory. I can mention here the triage protocols that excluded people with intellectual disabilities from accessing healthcare services because people with intellectual disabilities were identified as low priority for care. While we know that many data has shown that people with intellectual disabilities were at greater risk of death due to COVID-19. There are many studies that have been done in the UK and the US which has revealed these numbers.
Currently on.
With regards to social protection, many measures were introduced in different countries during the pandemic. These include, for example, the cash benefits or the provision of food and medicine. However, these were most of the time insufficient for the real need of people with disabilities, or not accessible to them in terms of information or in terms of the process, how to be able to benefit from these measures. We heard, for example, from our members that people without a valid ID card were not able to access these measures in some countries. And if people were not previously accessing specific disability tax credits, they may not have been eligible for the COVID-specific social protection measures. So these are only a few examples on how the pandemic may increase the risk, the existing inequalities between people with and without disabilities. As Inclusion International, we developed a publication which show the impact of COVID-19 on people with intellectual disabilities and their families. And we will soon publish it, so we will share it with you. And that's why, considering all these barriers, in our contribution, we suggested a couple of recommendations to governments. So governments should consult with and include people with disabilities and their representative organizations in all disability-related responses, policy design, and recovery measures. They should develop COVID-19 related policies that are inclusive of persons with disabilities and their families. These policies and programs should be CRPD compliant and based on a human rights approach rather than a charity model. Governments should ensure that social protection programs are accessible, inclusive, and that they include the disability-related costs. Governments should also ensure that people with disabilities are included and prioritized in the vaccination programs that are currently run in many countries. So I'm happy to continue this discussion and to give you more information in the session later. So do not hesitate if you have to share with us your questions. Thank you. Back to you, Mohammed.
Thank you, Manal. Shukran. Thank you very much for this great presentation and great recommendations. Indeed, we need to see more recognition of governments by governments for the rights of persons with disabilities and their families, especially in the process of decision making, especially now in the aftermaths of the pandemic and continuing this process of the implementation of the SDGs. Please let me now turn to Dwi Aryani from Indonesia. Again, Dwi is the Program Officer of Disability Rights Fund and Disability Rights Advocacy Fund, who's going to talk to us about Goal 16 and the challenges facing persons with disabilities with regard to access to justice, especially around the COVID during the pandemic time. Dwi, please, the floor is yours. You have 7 minutes. Thank you.
Thank you, Mohammed. Good evening from Indonesia, everyone. My name is Dwi Aryani, and today I would like to present the submission about Goal 16. And as a program officer for Indonesia for Disability Rights Advocacy Fund and Disability Rights Funds, I have been working along with the Organization of Persons with Disability at the local level and national level to ensure that the implementation of SDGs in Indonesia is inclusive and compliant with CRPD. The Goal 16 of the Sustainable Development Goal commits countries to promote peaceful, inclusive society for sustainable developments, to provide access to justice for all and build effective accountability and inclusive institutions at all levels. The COVID outbreak has led more than health crisis, threatening to leave deep social, economic, and justice access. Persons with disability and their representative organization had ensured that they raise their voice to ensure that the policy and program for COVID-19 are inclusive and ensure full and meaningful participation of persons with disability in the process, including monitoring and evaluation of COVID-19 programs. All this promotes strong institution and an inclusive society where persons with disability should be included and not left behind from the COVID-19 response.
It's 21 hours.
The availability of disaggregated data and reliable data on how many persons with disability have been affected by COVID-19 at all levels will be significantly ensuring policy and program of COVID-19 are inclusive for all persons with disability, including those marginalized groups within the disability. For example, indigenous person with disability, person with psychosocial disability, children with disability, women with disability, person with intellectual disability, and also those that living in the institution must be provided by information about how to protect themselves from COVID-19 and information about vaccines. This data is very crucial to build resilient and inclusive society during the pandemic. Women and children with disability are the most vulnerable group during the pandemic. Studies and research have been done during the pandemic, so increasing of gender-based violence case against women and children, including women and girls with disability, has been raised concern. The recent research that done by Association of Women with Disability in Indonesia also saw that from 50 respondents, 60% of them is not reported their cases. This is really high, some concern about access to justice for women and girls with disability during the pandemic. Access to justice as fundamental for the enjoyment of all human rights has become more challenging for women and girls with disability survivors of gender-based violence during the pandemic. Restrictions on the exercise of legal capacity, lack of physical access to justice, facility, stigma, multiply discrimination, and their intersectionality made even challenging for women and girls with disability to access to justice. So on this regard, we would like to recommend that states should take any measure to ensure all form of discrimination and violence against all persons with disability. By ensuring clear monitoring mechanism of policy and reach out children with disability, girls with disability living in the institution, and also ensuring that the justice system provided accessible and reasonable accommodation for persons with disability. The state should also take any measure to ensure data on number of persons with disability, women with disability, children with disability that face a gender-based violence. And also ensure that how many of them get the access to justice that they needed. State also should develop national target and indicator for tackling the particular barrier for women and girls with disability to access to justice system. And state also should ensure the rule of law to protect gender-based violence against women and girls with disability during the pandemic. Involving persons with disability and their representative organization in the decision-making process at all levels. This will be ensuring that the state will meet with SDGs 16 target on target 16.6. I would love to have discussion more with you all about these goals and how this how can we work together to ensure that access to justice for all persons with disability during this pandemic through pushing the implementation of these SDGs to be aligned with CRPD. Thank you. Over to you, Muhammad.
Currently on mute.
Thank you, Dwi. Thank you very much. All of the panelists today are amazing. They they kept it to the time limit they had. So thank you very much for being punctual and efficient with the presentation and with the wonderful recommendations you shared with us. So now we'll start the open discussion. It's around 10:05. We have 25 minutes. We would like to take a first round of questions or comments, maybe 3 or 4. And then we'll ask our panelists to react and respond to these questions. I would like now to turn it to Bethany to help me with just reading the names of and the questions from the audience. Bethany?
Thank you very much, Mohammed.
Thank you.
We have a question from Colin Bidwell. It's a very important discussion as technology and invention pushes the boundaries of what's possible, both in terms of claiming rights and pursuing a defense of those rights. So if any panelists would like to respond to that statement, that's one of the pieces of information that we have.
Thank you very much.
We have a few more.
Next.
If you'd like me to read a few.
Sure, please.
Okay. Jeffrey O'Darrow writes, my concern is what measures are in place to make sure that persons with disabilities bounce back to the new normal in this pandemic period with living standards and economic rights.
Mm-hmm.
And those are the questions that we have at this time. I imagine that this is feeding a broader thought process.
Absolutely.
And maybe have some more conversation.
Absolutely. So let's now turn back to our panelists and see if they would like to respond. So please, whoever wants to respond, you can go ahead.
I can go maybe by commenting some of the statements or questions.
Yes, sure. Go ahead, please.
So first, with regards to the technology, we know from what we've heard from our members that technology was one of the main measures that helped people in staying connected, for example. Many people with intellectual disabilities who has lost their support or had to be isolated could keep and maintain connections either with their families or with their friends through phones, through connecting with each other's. So that's right, that technologies are very have been very important during the pandemic. However, we should still keep in mind that while it can be very useful and helpful for some people, it's unfortunately not accessible for many others, and many others could not access, are still be isolated because they could not access to technologies or the phones and all other computer devices were not accessible to them. So yes, for technologies, but it should not be the only way of communication, and we should make sure that all people with disabilities can access to the needed information and can stay connected with each others. And with regard,
thank you, Manal. Yeah, go ahead.
Yeah, with just one comment on with regard the second question on what measures should be put in place. I think it's our role as civil society, as DPOs, to make sure that governments take all the necessary measures in order to make sure that people with disabilities can receive a good standard of living after the pandemic, and even better, because as I mentioned at the beginning, we know that people with disabilities are among the poorest one. There are many of them, even before the pandemic, were discriminated against. So it's really important to keep pushing the governments and to make sure that we are included in all the recovery plans made by the governments. Thank you, Mohammed.
Thank you, Manal. Anybody else of our friends of the panelists would like to answer? React?
Thank you, Mohammed. I would like to respond.
Sure, please. Yes.
Yeah, technology has been also challenging during the pandemic for access to justice for women and girls with disability, and also being challenging for those women with disability that also provide paralegal assistance for those GBV survivors. So I think it will be very important also to build collaboration, work together with women with disability and also with the women rights organization to provide support for gender survivor of gender-based violence, but also working together with the law enforcement, ensure them that their procedure, their mechanism, complaint mechanism is also accessible for women and girls with disability, and ensure that reasonable accommodation is provided during that kind of process. On the second question, I think, yeah, we have to ensure that all persons with disability have been represented in every design program, policy on COVID-19 response, and also involved in the monitoring of the program to ensure that the program is inclusive for all persons with disability. Thank you.
Currently unmuted.
Thank you, Dwi. Mr. Mohammed, would you like to respond?
Lucy and Kathy, to everyone.
Thank you, Mohammed. I think Dwi and Manal responded from every aspects. I just wanted to flag one issue that the technology is not actually accessible for all types of persons with disabilities. If the government and actors, both private and public actors, do not consider which technology works for which constituency of disability, the benefit of technology will not be useful for all. So this is one thing I wanted to flag. And in Bangladesh, we are experiencing Bangladesh government and private sector taking many initiatives to continue their activities through online or virtually, but persons with disabilities are becoming excluded just because of not being accessible. The technologies are not being accessible. So this is I wanted to say. Thank you.
Thank you. Thank you very much. All right, we can go now for a second round of questions or reactions, comments.
Thank you, Mohammed. We have two hands raised, one from Arbi Choik and one from Lucy Nakata. I see that Arbi's on.
Betty, we cannot hear you
properly. Hear you, Bethany.
Okay, let me try it with my mic on. Thank you for letting me know.
Technology. We're talking about technology.
Thank you for your patience. So we have two questions from Arbi Choik, who has a hand raised, as well as Lucy Nakata, who also has a hand raised. Could I ask the organizers to please open their mics so that these two people can ask their questions? I will ask Lucy to go first, please.
Lucy Kaffa has joined.
Can you hear me?
Yes, we can. Please go ahead.
Yes, we can hear you.
Oh, yeah. I've already posted my question on the chat box because I thought maybe it's not their time to talk. So maybe somebody can read it. Yeah, but my concern was, how do we persons with the disabilities organizations, because we know they have a role to play, and this role that they have to play, they have some limitations. For example, the expertise, maybe to do the petitions, the facilitation to follow up. Sometimes they are limited by resources. So how do we, my question was, how do we empower these organizations of persons with disabilities? We have seen success stories of them advocating and lobbying for things to happen with their governments, and it has happened. We've done so much in Kenya with the help of UDPK and other partners to lobby our governments in different areas, and we've seen things working. But now the challenges that we've had is sometimes, even when we write those petitions, we don't have that expertise. So sometimes even to get people who can be able to do good petitions and then take them, and the follow-up process has been an hindrance. So I think it is an area that all the people who are involved in this, to ensure that there is meaningful employment of persons with disabilities, I think they should look into this aspect. Thank you.
Currently unmuted.
Thank you, Lucy. Who was the second person? Somebody else also has a question.
Apologies. Yes, we have another question from RB Choik. RB, if you'd like to take the
Arby
floor,
Schwalik has joined a meet.
Yeah.
you are welcome.
Hello,
Currently unmuted.
do you hear me?
Yes, we hear you now.
Yeah, okay.
Lucy Kaffa has.
Thank you so much for all the panelists for their appreciated presentation. In fact, my question is the following. How do you think that we can concretely measure the affordances that technology provided to persons with disabilities during COVID-19? And how can we also measure the way that the persons with disabilities were using tools and technologies such as social media? And how is the importance of involving the organizations of persons with disabilities in such measurement? Thank you.
Thank you very much. Any other questions?
Yes, we have one more question that's been put in the chat, sent to us from Liz Ombati. Liz, if you would like, you're welcome to take the floor to ask your question yourself, or I can read it.
Liz Ombati has joined.
Stephanie, please, you can read it.
Okay, thank you. In terms of pushing government, a valid response that Manal raises, yet the reality is that many organizations of persons with disability still face such challenges as having their issues actually captured by government, let alone being acted upon. How much more can they keep pushing, and what can they embrace to ensure that their voices are actually captured by government and development partners? And that question was directed to Manel specifically.
Currently unmuted.
All right, I think we can go back to the panelists. Maybe we can start with Manal, because there is a question asked, it was directed to you, so.
Yes, sure. Thank you, Liz, for this question. I know our main job as organization with disabilities is always governments. What can we do more? I think maybe we can push differently, because of course it's not the same as when we do some work at the national level, but we do it at in the global level. Maybe we can use the international mechanism that we have as Organization of Persons with Disabilities. And for example, I think the high-level political forum is one of the way in pushing the governments and communicating with them, for example, through participating to the VNR processes, the voluntary national reviews, participating to the regional forums on the SDGs, where we can, as civil society organizations, have a say in such forum where there are governments representatives, civil society organization, UN agencies, and it's a place where there are multi-stakeholders, and we know that governments don't want to have or to receive any critical or comment. So I think using the international mechanism can be a good way to push more for the governments. If I can also respond to the other questions.
Currently
the first one, how to empower organization and give them the expertise. I think one of the way, so we can have two ways. One of them is using, for example, talking from my perspective, representing a network of organizations of persons with disabilities. We really value the networking and sharing the expertise between our members. We know that organizations of persons with intellectual disabilities and families, they have many experience in different areas, and ensuring that they can have these connections and ensuring for them a way to communicate with each other is a really good way to empower them and to share the knowledge that they have. And another way is using international cooperation and the development organization. There are many funding that are going to organizations of persons with disabilities in order to do projects, to do trainings that they can use in order to improve their expertise. And on the last question with regards the measures, thank you, Arvi, for this question. While I'm not expert with regards the technology measurements, but I think the best way to know whether these measures are affordable or have been used by persons with disabilities and by organizations is to do it through surveys. There has been a lot of surveys, online surveys done by IDA, for example, on the experience of organizations of persons with disabilities during the pandemic, the barriers that they faced, the challenges that they faced. Ourselves as Inclusion International, we did surveys and through webinars to our members in order to collect their views on the barriers they faced, the solutions and lessons learned from during the pandemic. I think these are the answer. And
Currently
I like
unmuted.
the other panelists to continue.
Thank you very much, Manal. Any Dewey or Mr. Mohammed would like to answer or add anything?
Hi, Mohammed.
Yes, please go ahead.
Okay. Actually, one thing we need to remember and we need to highlight always, that is the consultation with persons with disabilities and their representative organizations has no alternative. When we work with any issue for the betterment or development of the people with disabilities, we must have to follow this as a maxim. And therefore, in terms of regarding the question one, which was about I think capacity building or OPDs, I must say that every government or non-government actions should be started with consultation and meaningful participation of persons with disabilities and their representative organization. Otherwise, the actions will not work. This is, I am telling this from my few years of experience with these initiatives. Thank you.
Currently unmuted.
Thank you, Mr. Mohammed. Dewey, do you want to add anything? We have 4 minutes before we adjourn the webinar.
Thank you, Mohammed. Yes, just add some additional answer or comments.
Yes, please.
So I think, yes, it's very important that the organization of person with disability engaging in the process and how
Come on, now, Mary, to everyone.
this can be reached out. I think it's good to also build a collaborations, constructive dialogue with other movement also, and engaging in many different SDGs mechanism. For example, in Indonesia, we have civil society SDGs forum, so DPO can be also a part of that forum and work together with the government to ensure inclusive SDGs implementation at province level or at national level or district levels. And to answer, I think there's a question from RB also about using the social media. I think, yes, it's very powerful also tools to be used. For example, in Indonesia, the survey that done by the organization of women with disability also use the social media to share about the result and the concern on the high cases of GPV against girls and women with disability, and how we can work together, and also using the social media also to provide a solution in how that all stakeholder or law enforcement should have understand the difficulty barriers that women and girls with disability face in accessing to justice, and recommended that there's need to collaboration and work together to ensure that the services, law enforcement, and the system is access and provide reasonable accommodations. Thank you.
Currently unmuted.
Thank you, Dewey. Thank you very much.
Zoom.us has new.
Unfortunately, we are coming to the end of this webinar. I wish we have more time. We can continue this wonderful discussion. I would like to thank the panelists for their excellent presentations and meaningful recommendations, very strategic and really hit the point. And I would like to also thank everyone who had an input into the submission papers for the HLPF. I would like also to thank the organizers who were coordinating and preparing for this event, the sign language interpreters and the captioners. Of course, thank you very much for
to everyone.
great help. Of course, I would like to thank my co-moderator, Bethany, for her help and for everything. Thank you very much, everyone. Please stay in touch with the stakeholder group of
We are
persons
on
with
YouTube.
disabilities. We
Zoom down.
encourage you all to be part of this process, particularly with regard to the work
now,
that
Mary.
your governments are putting together to submit their reports for the HLPF and
To everyone.
I mean the National
Outlook has new.
Voluntary Reviews. Thank you very much, and we look forward to seeing you in our next webinar, if not the HLPF itself. Thank you very much, everyone.
Thank you.
Bye, everyone. Have a good day.
Bethany.